Parents have been arm twisting me to ask me what a nursemaid's elbow is and how it can be treated or prevented. Well, let me lend a hand to everyone on this topic. Nursemaid's elbow is one of the most common injuries of early childhood and is another term for a partially dislocated elbow joint that carries the medical name radial head subluxation. It's also affectionately called a pulled elbow due to the way this injury occurs in children between 1 and 4 years of age. Why in younger children? Because at those young ages, the ligaments or bands that hold the radius, one of the elbow bones in place, are loose and not fully formed, so this bone can slip out of those bands. With aging, these bands become tighter around the radius, preventing less slippage, which is why we don't see this problem in older children. What causes this type of injury? Well, pulling a child up by their hands or wrists rather than under their armpits, swinging a toddler by their arms or wrists, jerking a child's arms suddenly while walking to pull them back from traffic, or breaking a fall with an outstretched arm, boom, can result in slippage of the bone outside the ligaments. How do you know this type of injury has occurred? Well, actually, pain is not a prominent sign, but is usually mild and short-lasting. What you're more apt to see is a child who refuses to use their arm and keeps it in a fixed position to their side with a slight bend in the elbow and the palm turned toward the body. If someone tries to straighten the elbow or turn the palm upward, there can be more pain without significant visible swelling or a deformity. In fact, if there's a lot of pain, well, that may signal more of a fracture or bruise than a dislocation. If you think you can't be sure or think it is a nursemaid's elbow, seek medical attention to help make the diagnosis. Your child's healthcare professional can examine the arm and make sure it's a simple dislocation, and if it hasn't relocated by itself, and some do, then they do a brief maneuver to relocate the ligament back into position. Usually the arm is mobile within minutes after doing this relatively painless maneuver, and if not, X-rays may be warranted to make sure there's no missed fracture. Can you prevent a nursemaid's elbow? Sometimes you simply can't, since kids are prone to injury, but parents should avoid tugging, swinging, pulling up, or jerking on their young child's hands or arms. Hopefully, tips like this will relocate any out-of-joint thoughts you may have when it comes to having a better understanding of what a nursemaid's elbow is all about. This is pediatrician Dr. Lewis First from the University of Vermont Children's Hospital, reminding you to always be first with your kids.